Bienvenido a la ciudad de Coachella. My name is Steve Hernandez, and I am the mayor of the city of Coachella. And on behalf of my colleague, Mayor Pro Tem Gonzalez, who is here, and all of the Coachella City Council, we want to welcome the governor of the state of California, Governor Gavin Newsom, to this beautiful city of Coachella. In many parts of California and the nation, there exist rural and suburban communities that look a lot like Coachella. These communities are made up of people of color, brown and black folk, the poor, farm workers, and everyday working class Americans and immigrants who, throughout this pandemic, have not been able to shelter from home. We know the statistics in these communities as it relates to infections and mortality and poverty, and the outcomes have been devastating. But there is hope in the stories being played out here in the city of Coachella and in the eastern Coachella Valley. The model being employed here is an example for the state and nation. The intersectoral collaboration where nonprofits, business, and government are working together to address public health outcomes and the pandemic, it stands out. Nonprofits such as TODEC are the perfect messengers and are helping to build trust in the community for folks that have doubt with the vaccine. Our businesses such as Seaview and many others are giving workers the time off, making their facilities and buildings available, and coordinating with public health. And our public health officials, such as the County of Riverside, the Desert Healthcare Agency, is delivering the vaccines through mobile vaccine drives and providing the professionals to administer the vaccines. We are grateful here in the city of Coachella to the County of Riverside and the state of California for helping to ensure that we not only talk about equity, but more so that we deliver a solid plan and act on that plan to make sure that the vaccine is equitably administered to the people of color and that our communities have a chance to survive and prosper during and after this pandemic. For many of us here in the city, the work is personal as we are the children of farm laborers. I'm the grandson of a bracero who raised me. We know what it's like to lack access and resources, and conversely, we know what a hand up can do for all of our lives. To the mayors and leaders in communities that look like Coachella, ask not what the governor can do for you, but what you can do for yourself to convene stakeholders, inquire about their needs, listen to them, and show empathy to assemble your own task force and deliver the vital resources your community needs. I want to thank the governor who in this difficult time has not forgotten about communities like Coachella and has made it a point to visit communities in the eastern Coachella Valley. I also want to thank the state of California and Dr. Galley, the county, the special districts, the federal government, the nonprofits and businesses, and all of our partners who are breaking the silos that we sometimes get into and are working intersectorally to ensure that we can beat this pandemic. I have the distinct honor of also introducing Kim Sarawatari, who is our Director of Public Health and who has put together this great intersectoral collaboration. Kim, I got a City of Coachella hat for you, and I also got one for the governor, so I'm gonna give you these hats. This is a real, and now you can say you've been to Coachella, by the way.
All right, good morning, everybody. Kim Sarawatari, Director of Public Health for Riverside County. And I'd like to start off this morning First, thanking Seaview for hosting us today and for making this event possible so that we can vaccinate farm workers where they are, where they're working, and make it easy for them to get the vaccine. I also would like to thank the governor for being here. We are so excited to be able to showcase the work that all of our collaborative partners are doing today, and show the governor that not only the city of Coachella, but the whole county really comes together so that we can wrap our arms around our vulnerable communities, make sure that they have the support that they need, they're getting the vaccine, and we are prioritizing them. I also would like to thank Mayor Hernandez and the city of Coachella for hosting us as well. I have the good fortune of being able to talk with the city council there on a regular basis, and they are very, very committed to making sure that their community gets vaccinated, gets information, and that they stay as healthy as possible. So I want to spend just a minute talking about our collaborative and some of the work that we are doing out here in the Eastern Coachella Valley, as well as actually throughout the county. So this collaborative started as an idea, and we reached out to the Desert Healthcare Foundation, Dr. Barzaga and Alejandro, and talked about how we could bring together community, how we could bring together faith-based organizations, and really serve the people that need the assistance, right? Really reach out to community and meet people where they are. And so Dr. Barzaga said, I'm in from the very beginning. We identified community-based organizations, got them involved. Luz from TODEC, we have Alianza, we have Lideres Campesinos, we have Visión y Compromiso, well over a dozen community-based organizations that are regular partners with us, as well as the Archdiocese of Riverside and San Bernardino counties. And we have a very strong collaborative. So we started with education and outreach, going out into the fields. The growers have been extremely generous, allowing us time to do that. Growing Coachella Valley has assisted with arranging that. So we started going out into the fields, talking about what is COVID-19, how can workers protect themselves. And then we started with our testing outreach efforts. And so we literally had people out in the fields, TODEC, registering people for testing, conducting the testing, getting results back to them. And then we increased our sphere of influence, and we added a piece where anybody who tested positive, the public health department let our partners at Visión y Compromiso and El Sol know. They reached out and provided the social supports for these individuals so that they could stay home and quarantine or isolate when they were sick, and their families could quarantine so that we could try to get our arms around disease. And now that we're into the vaccination phase, same thing, all of the community-based organizations and faith-based organizations coming together to deliver vaccines out where people work to make it as easy as possible. We know that it's not easy for the farm workers to get out to our mass vaccination sites that are fixed sites. They don't have the flexibility with time off work. They don't necessarily have computers at work. So again, Luz and her team from TODEC are out in the fields registering proportionate impacts of COVID-19 on our population. Next population.
Speakers. Before I begin my remarks, I'd also like to acknowledge that we have a really amazing partner with us here this morning, and that's Tribal Chairman Daryl Mike with the 29 Palms Band of Mission Indians, who from day one has been committed to COVID-19 testing on his site in partnership with the county, our FQHCs, and just wanted to recognize his presence as well. I also want to recognize Councilwoman Josie Gonzalez, who also is here with us. We also have an elected official from the College Board of the Desert, B. Gonzalez, who works with our children after school programs that from day one, they've kept feeding our children and their families during this pandemic. And lastly, and it's been mentioned time and time again, the Desert Healthcare District has played a critical role in the efforts that we're highlighting today, and an elected representative. Thanks to the expansion of the healthcare district, thanks to everyone who's standing here who made that happen, Leticia De Lara, who represents this area. So I just wanted to acknowledge their work in this effort. Mr. Governor, we are here in the beautiful Eastern Coachella Valley, and it is a community that intersects with the Imperial County and the Palo Verde region that really is responsible for feeding the entire nation. And I know that my colleagues from the Central Valley and the coastal communities up there will take the the credit that they are the breadbasket, right? And so I think there's enough room for all of us to be the breadbasket that feeds the nation and if not the world. And we also know that we drive the engine of our economy, and so that much more important that we're paying attention to the people, to the human element that we're here to discuss today. Many of our families, as been mentioned, have been intimately involved in this work, and now we see how impacted our workers in our agriculture community have been due to COVID-19. In fact, I recall my parents traveling from Imperial County, starting in Hopeville, coming down to Coachella, going all the way down to the Salinas Valley, the Gonzales area, to work in the fields. And so this, again, is extremely personal to us. And as you've learned this morning, the first labor contracts for grapes with Cesar Chavez were signed here, and some of the first organized efforts with our Filipino brothers and sisters occurred here. So this is a very historic and symbolic place in the state and the nation for us when it comes to agricultural communities, agricultural workers, and what we're here to discuss today. Much has been said about equity, and I think that it's important, Governor, when we talk about a California for all, we must implement the issue of equity in everything that we do when we're talking about investing in clean water for our people in Coachella Valley or Central Valley, when we're talking about housing, and when we're talking about now the distribution of the vaccine for COVID-19. Equity has to be front and center of our strategy in order to address this pandemic that we're facing and the disproportionate impacts. Governor, you know the statistics, 800,000 plus workers throughout the state that work in this industry, and you also know how impacted these communities have been. You also know that the Imperial County, Riverside, in order to avoid the type of impacts that we've seen with COVID-19 today. But we also know, because the data doesn't lie, that today, those who work in the fields, those who work in our restaurants, those who handle food, our grocery stores, have disproportionately seen the brunt of COVID-19. And so as we build out this vaccination infrastructure, because we are preparing throughout the state and specifically here in this region, this is the beginning of a lot more work to be done. We are building the infrastructure as we prepare for vaccines to come. We need to be intentional with that supply of vaccines. We have to be intentional with the vaccines that come to California so that we can curtail the spread of COVID-19. Let me give you an example. In Imperial County, we're getting 1,200 vaccines a week. Well, there are double the amount of people getting COVID-19. And so we're never going to solve the problem until we actually begin addressing vaccines to those who are spreading COVID-19, which are the workers in our fields. But I know that there are better days to come because the federal government is stepping up, the manufacturers are stepping up, and the alignment within our governmental agencies is here. We have friends in Washington, D.C. that are helping us ensure that California and its people are front and center when it comes to addressing COVID-19. And so I'm excited about that, and I'm really excited again to just recognize the collaboration, and I know the mayor uses the word, and I think he learned it at USC, the intersectoral, collaboration that's happening between government, nonprofits, tribes, right? Our federal, state agencies, our community-based organizations. It was mentioned earlier, Luz, thank you for the work that you're doing. And the state has a tremendous amount of trust in you and in the work that you do to reach our hard populations, our folks, right? Here in our communities, the Department of Public Health for Riverside County, you've gotten the good, the bad, and the ugly during this pandemic. And we want to just recognize the good today that you're doing. The first county in the state of California to implement a vaccine for farm workers today. Thank you for your work. And Supervisor Manny Perez for your leadership. I know it hasn't been easy during this time, but thank you for that work. We also want to recognize the collaboration, the equity collaboration between the Coachella Valley, and that's made up of a lot of grassroots organizations and of course the healthcare district that I'm very proud that many of the folks that are here push really hard that had the vision to make sure that we expanded that healthcare district to ensure that today they could do the work that they're doing today. And if there's anything that we should be proud of, was that effort that's making a difference in the lives of many people today, and we're going to see that today. And without a doubt, we have to recognize our partners. Our farmers are collaborating with us because we have a mutual interest. That mutual interest is our folks that we represent, the people that work for them. We need healthy people for healthy economies, and that's extremely important, and so we thank them and recognize them. And without a doubt, we've had a champion on the ground, and we're lucky to have what I have called our own Dr. Fauci-Reese, right? Dr. Fauci-Reese, our congressman, who has been out there working day in and day out, even to the point where he's out there vaccinating folks and checking them on a first kind of hand basis. And so we're very lucky to have that type of leadership here. And as I mentioned, we're all very committed. Why? Because we were born here, we were raised here, and because our parents are the folks that are going to get the vaccination here today. Muchas gracias a todos los que están aquí con nosotros esta mañana. Unas palabras breves en español. Hablamos mucho de la equidad en lo que se habla de la vacuna. Necesitamos decir la palabra equidad, pero con palabras que también enseñan acción. La acción que es necesaria para asegurar que cuando estemos distribuyendo las vacunas por el estado de California o haciendo inversiones en infraestructura para asegurar que tengamos agua limpia y saludable o vivienda, que vengan esos recursos a las comunidades más necesitadas. Y por eso es de gran importancia esta colaboración que se está tomando a cabo aquí dentro de esta acción que se toma hoy y el trabajo que se está haciendo por parte del condado, las organizaciones no lucrativas, los gobiernos federales, estatales, locales y nuestras tribus que son soberanas también. Con eso le damos la bienvenida al gobernador. Mencioné en el inicio de mis palabras que es el primer gobernador que nos visita aquí en Coachella en el tiempo que yo tengo en el servicio público, y es un gran orgullo poder darle la bienvenida, y muchísimas gracias por todo el trabajo que se está haciendo aquí hoy y en los días que vienen. Gracias.
Thank you all for being here. I want to echo the sentiments of previous speakers who have said that this is personal. I want to thank the governor for being in my hometown of Coachella, something that we have never seen before in my lifetime and I think in our history. We have had other local elected representatives who have never stepped foot here in Coachella with farm workers. Most national or state elected individuals go to Indian wells, into fancy country clubs, with very rich and powerful people. But not this governor. This governor goes to the people, where they're at, right here with the farm workers, with the laborers, listening to the stories of real life experiences of men and women who work tirelessly with tired backs and calloused hands day in and day out to feed America, to feed you, to feed us. And for that, I am incredibly proud. And I want to thank the governor for taking the time to visit Riverside County here in the Coachella Valley area, and specifically in Coachella. I'd like to thank the governor for his decisive leadership throughout this pandemic and his life-saving efforts to follow the science to get us through this public health crisis as safely and quickly as possible. And as an emergency physician and a public health expert that spoke with national leaders, scientists, local epidemiologists, I can say with absolute certainty that Governor Newsom saved millions. And I'll repeat, Governor Newsom saved millions of lives with his early, decisive decisions. And when I say that with an incredibly sincere heart, as a doctor and as a child of farm workers, as somebody who grew up here in the Coachella Valley, when I was desperately sounding the alarm to oftentimes closed ears, his decision saved lives. It could have been your family members, our parents, millions more are alive because of this governor. And ending this pandemic quickly, safely, equitably requires a strong federal, state, local, nonprofit, and community partnerships, which is exactly what we've built over the years. Collaboratives are a mainstay in the Coachella Valley. And I want to thank some of the pioneers who have developed this collaborative models throughout the years. Supervisor Perez, Assemblymember Garcia, the Mayor Steve Hernandez is here, and Chairman Mike. I got to say this because every time I speak as a member of our federal government, that it is important to recognize the chairman and the tribe as a sovereign nation, tribe to federal government directly. And so that's why it's important that we recognize the chairman and our sovereign nations that are here. I grew up in a trailer park the early years of my life with my farm worker parents who worked day in and day out, sacrificing in order to give us opportunities that they've never had. And I carry those stories of hard work, determination, and social responsibility with me wherever I go. And I know firsthand that while farm workers have risked their lives throughout this pandemic to put food on our tables, they have also been at high risk of getting, spreading, and dying from COVID. And this isn't just theory, this is the data. We know that Hispanic populations, and in particular the high-risk essential job workers, the farm workers, the produce packing, the meat packing, the grocery workers, have a higher incidence of getting infected and dying from COVID-19. This is why very early on in the summer, I worked with the Coachella Valley Volunteers in Medicine. I worked with Visión and Compromiso. I worked with the Desert Healthcare District to provide in-person testing for our farm workers at trailer parks, at our schools and our churches, and also the homeless under the bridges, out in the desert, by the railroads, along Indio, to go to the hardest to reach, most vulnerable members of our communities, and oftentimes ignored. You see, farm workers are at high risk because they work in high-risk essential jobs, oftentimes with poor precautions offered to them to keep themselves safe from COVID-19. That's not the case in some of our growers, with our growers here in the Coachella Valley. But throughout the nation, it is the case. Second, they live in tight quarters, overcrowded areas with 2-bedroom trailers, low-income housing, farm worker housing, with 3 generations without the ability to quarantine or isolate. And oftentimes, they're too concerned about missing work because how else will their children eat? Furthermore, they are at higher risk of being under-resourced, Governor. Here where you stand, there's only 1 full-time equivalent doctor per 9,000 residents. I know I did the research in 2010 and literally counted the hours of the doctors in every clinic that existed here under the Coachella Valley Healthcare Initiative. To be medically underserved, you have to have 1 per 3,500. The federally recommended number is 1 to 2,000. We have 1 to 9,000. We don't have enough clinics. We don't have enough nurses. We don't have enough promotoras. We don't have enough resources to come into our community. So in Congress, I've been advocating for those resources to come here in Riverside County, in particular District 36. In March of last year, we passed 3 pieces of legislation to respond to the unfolding public health and economic crisis, including the CARES Act, which provided $150 billion in direct assistance to state and local governments. That money has allowed the county and cities to pay our frontline heroes, provide small business assistance with those programs with Live to Rise and others, and administer the vaccines, testing, and treatment to our residents. And the good news is that we are working on another relief bill as we speak. We just passed a multi-billion-dollar package from the Energy and Commerce Committee, where I am a member of, and we also are advocating for $350 billion more in funding assistance for the state. And I know that makes you very happy, Governor, and also Supervisor Perez, because those are the monies that will come into the state, into the counties, and in addition, direct assistance to the cities, like Palm Springs and Desert Hot Springs and others that have taken a big hit during this pandemic. And I am pushing for this money to help state, local, tribal governments that have faced higher costs and lower tax revenue during the pandemic, so that Riverside County and our cities aren't forced to make deep cuts, so they can continue to provide the assistance that the healthcare district, that Luz Gallegos and Todec, so that the other nonprofits can get some of those assistance, so that we can keep our teachers in the classrooms working, our firemen and our police taking care of our communities. The relief bill also includes $20 billion in investments in equity vaccination programs, precisely to fund initiatives like this, with mobile health clinics, worksite inoculations, collaborations with community health workers, promotoras, and nonprofits to help tribes and territories address their needs as well. This funding is key to help our federal-state partnership to provide resources to our hard-to-reach communities, resources like the state-federal partnerships with community vaccination centers like the ones in Oakland and East LA, mobile vaccination units, increased community healthcare sites, and investments in health services in tribal lands. And I'm proud of our strong state-federal partnership. Your office has been great to work with. The State Department of Public Health has been working closely with us and bringing in FEMA resources initially and making sure that we get vaccines into our county and into this district. And I look forward to our continued collaboration to ensure equitable vaccine distribution that prioritizes high-risk individuals like farm workers. So you go to where the risk is at. Equity means to prioritize the resources where the highest risk exists. It's so simple. So when you have high-risk individuals of getting infected or dying from COVID-19, you prioritize those resources in those communities. Equity must be in the forefront, not only in the legislation, but also in the administration of vaccines and COVID relief all over our nation. It should no longer be an afterthought, and we should no longer act surprised when there are disparities in equity, disparities for those that are highest risk of getting infected and dying, and yet they have the highest risk of not getting the vaccines. This model is good. This model has been something that we've been talking about for a long time, since the summer. Go to the site of highest risk, workplaces. Go to the site of highest risk, low-income housing, farm worker housing. Work with community. But we need the resources. We need the vaccines. We need the allocations, even within the county, into these communities, and we're going to push to get them. The retail pharmacy program is a good federal program. Equity means that they are offered in the hardest hit communities first. Open to everybody. Direct assistance to FQHCs from the federal government is another equity provision that President Biden is going to be initiating. We need to make sure that they are here in our county. Con eso les quiero dar las gracias a todos que están aquí. Les quiero decir que el gobernador Newsom ha hecho un buen trabajo. Estoy muy orgulloso con él, porque él, con su decisión decisiva en los primeros de la pandemia, salvó a millones de personas que estaban en peligro de perder sus vidas. Otra cosa quiero decir a la comunidad que habla en español, que nunca hemos visto un gobernador estar aquí en Coachella con nuestra gente, hablando directamente con nuestros trabajadores. Y eso es algo muy importante de entender, porque este gobernador no fue a los lugares poderosos y ricos aquí como otros gobernadores para sacar y levantar más dinero y fondos. Él vino donde estaba la gente sufriendo, con nuestra comunidad, con nuestra familia, a escuchar nuestras experiencias y historias, y por eso yo estoy muy en favor del gobernador y con todo lo que ha hecho durante esta pandemia. And I think that the next speaker is going to be Supervisor Perez. Thank you.
Good morning, everyone. Buenos dias. And I think you heard quite a bit already from the experts. I don't want to belabor the facts and the data that stand out for themselves, but I think it is important that we do recognize the fact that our Governor Newsom, has done an outstanding job for the state of California. Obviously, there's differences of opinion, but at the end of the day, the way I see it, this man has stood up for us, for the underserved, and we need to do our part as well to stand up for him. I want to thank the Seaview Packing family for allowing us here today, and all the other ranchers that are also collaborating and coordinating with the county of Riverside and with the nonprofit organizations, with the Desert Healthcare District, and ensuring that our farm workers are vaccinated. I understand that today we're going to have about 350 vaccinated, but we've had over a few thousand already vaccinated through this model of ensuring that we go out into the communities, the grassroots organizing on the ground. That's where I see the equity as well coming in, is that we're actually in the community, that we're actually in the fields. And TODEC, with Alianza and Bison en Compromiso and other organizations, are doing just that. I appreciate that work. We all do. And it's a pleasure to have our governor here. And it is right, everyone has said it already, that he is the first governor to ever visit the city of Coachella. And obviously our county of Riverside is honored to have them. And I also just want to say, I want to put in a plug for my county board of supervisor colleagues. We don't always see eye to eye. We have 2 Democrats, we have a Libertarian, and we have 2 Republicans. And it's been a struggle. Earlier we were talking, Governor, when we were walking, and you were mentioning that you want to have a conversation maybe one day in the future as to how my experience has been. It's been a struggle. It's been a tough one. But I also want to say we're continuously pushing for the resources. We're continuously pushing for the political will to recognize that we need to come out here to the areas in which people are really struggling and suffering. And so, little by little, we've been turning that corner, and folks have been working with me, and I just want to say thank you to my colleagues on the Board of Supervisors that even though sometimes we're struggling and duking it out, at the end of the day, they saw this as an important effort, as well as our County Department of Public Health. Dr. Young, Dr. Kaiser, Kim Sarawatari, thank you, and all the others that are part of the team, Brooke, Yaoska, right? Your team as well, for ensuring that we get out and we communicate and we deliver the message of hope. And earlier today, we heard from a couple of farm workers, and they were concerned in the beginning of taking the vaccine, and because of all the rumors that are out there and the misinformation that exists that's out there. Well, the County of Riverside, through our PIO and through the promotoras and Desert Healthcare District, CV Grow, all our partners coming together to deliver the message that the vaccine is effective. It actually works. And do not pay attention to the misinformation that exists out there. Now, you've heard this already, but I got to say it as well. I am very proud to be here as the son of immigrant farm workers as well. And I grew up in Cochelita, down the street, Avenue 53. And I remember throwing the newspaper out there when I was a kid, and I remember working the fields as well, alongside my mother, giving her the boxes to her cuadrilla, and stamping those boxes so that we can ship those grapes out. This is personal to all of us that grew up here. And I also, as the County Board Supervisor representing the 4th District, as well as the Chairman for the Latino Caucus of California Counties, this is very, very, very important to all of us. As a matter of fact, we made this issue a major issue, the #1 issue for us. And we've been working with Dr. Galley and with Ana Matos Santos through the kitchen cabinet to advance that effort. And while we're speaking on that, I've always heard already since the very beginning from the media, what else can be done? Are you doing enough? Do the plans exist? Do you have the resources? Well, there's always more to be done. But I will put in this plug, and this is where I believe our congressman is very important, and others as well at the federal level. We need comprehensive immigration reform. And I also know that Governor Newsom, you've been at the forefront of that fight as well. And so I want to put in that plug because it's important that we recognize that need so that our families, our farm workers don't continue to live in the shadows. I don't want to miss any organizations. I'm going to try to list them here. Desert Healthcare District, Alianza Coachella Valley, the Galilee Center, El Sol Neighborhood Research Center, Youth Leadership Institute, the UC Riverside School of Medicine, Riverside County Public Health Team, obviously TODEC, and Visión en Compromiso, and there's probably others, but I just want to say thank you to all of you, and as well, Governor Newsom, thank you for all the funds that we received through you, to the federal government. Raul, thank you as well. At the end of the day, people always ask, what does the county do? What's the purpose of county government? Well, we're somewhat of a pass-through. Everything that happens at the federal level, at the state level, comes through us. And then we work with the ground to implement and to coordinate and to administrate so that we meet the needs of our folks. Rápidamente, muchas gracias a todos que están aquí, a todas las organizaciones que han luchado para que nosotros podamos estar aquí esta mañana. Me da mucho gusto que estamos aquí con el gobernador Newsom, que es nuestro amigo, Y como él está luchando para nosotros, nosotros también tenemos que luchar para él. No queda fallar eso. Y estaba hablando con el gobernador más temprano y tal vez después de esto vamos a comer unos tacos en Jalisco. A ver si quiere ir. After this, Governor, I know you got a schedule, but maybe after this we'll take you to Jalisco to one of our best taquerias in the city of Coachella. With that, thank you everybody for being here. I want to say, Governor Newsom, our cleanup hitter for the day, please come on up. I heard you had a scholarship back in the day to play baseball, right? Your turn to hit a home run. Thank you, Governor.
Well, a hell of an introduction. And remarkable comments from each and every speaker, truly remarkable comments. And I will be brief as much as I can be in updating and providing an overview of where the state is as it relates to this pandemic and where we are specifically as it relates to the vaccines. But I'm here really in the spirit of gratitude, respect, and moreover admiration for the incredible leaders you just heard from the supervisor. And as a former supervisor, I know intimately what supervisors do and what this county has done, no other county in the state had done. You were first to advance the cause of equity, not as a rhetorical flair, as the doctor was saying early in our briefing, but substantively and meaningfully. To the assembly member who has been extraordinary in his advocacy, I'm here as well in gratitude and admiration of his leadership for securing an additional $24 million that we'll be announcing today for our Housing for Harvest program all throughout the state of California. You have leaders here that have been on the ground delivering on that program, helping our farm workers, creating opportunities for quarantine and isolation and opportunities to house our farm workers to guarantee their health and safety. To Dudek and Luz, who's done an amazing job on the ground to truly bring in language, cultural competency to a whole nother level. My gratitude, my admiration, my appreciation. To the congressman, you heard the passion from the mayor, from the congressman. You heard it from the assembly member and the supervisor. This is a lived experience. It's one thing to intellectualize the reason we're here. It's another to experience it generationally. What an extraordinary journey they have been on and their families have been on. What a remarkable community this is. What a special moment this is to highlight not only their journey, but the journey of so many others that make up the vibrancy of this remarkable part, this remarkable region here in our state. To Seaview, thank you for your partnership. As it was noted by the supervisors, thank you to the farmers, the ranchers. Thank you for recognizing and valuing your workforce. To the farm workers themselves, these things don't just magically arrive in the grocery store. There are folks out there every single day in 120-degree heat that make sure these arrive on your grocery store. And that's a remarkable thing. And we're here to celebrate them, truly essential workers here in this state and all across this country, but particularly here in our state. We're here to identify their remarkable contribution to our state and nation, but also to recognize our unique responsibility to do more and do better to support them. And frankly, we haven't done enough, and we have to own that. We have to recognize that we haven't delivered on equity like we should, like we must, and it's not lost on me. You heard it from every single person that spoke. This was a pre-existing condition even before COVID and the pandemic. Those disparities have only been highlighted because of this pandemic. And so it's incumbent upon us, because our minds are stretched, our capacity of understanding is so much more vivid, that we do something about it as we begin to turn the page. And that's what I want to briefly talk about here today. 1 month ago today, we had 11.3% positivity in the state of California. Today, it's 3.3%, 11.3% to 3.3% just in the last 30 days. 1 month ago today, we had 42,000 reported cases. Today, just over 4,000, 42,000 down to 4,000. 11.3% positivity down to 3.3% positivity. In the last 14 days, 38% reduction in the number of people hospitalized with COVID-19. In the last 14 days, 33% reduction in the number of people in our ICUs. We have an R effective, something I know many of you understand, some of you don't, but the rate of spread now down to 0.65. We haven't seen that in many, many months in our state. We are in a very different place than we have been because of all of your hard work. Each and every one of you doing your part to do the masking, to provide as much confidence you can, assurance and strangers that we're socially and physically distancing from one another. But the vaccines are foundational and fundamental, and I'm here in that light to talk briefly and open up to questions about our vaccine efforts here in the state. There are only 7 jurisdictions in the world, nations, that have vaccinated more people than the state of California. Over 6.3 million people have been vaccinated in this state. We're averaging roughly 200,000 vaccines each and every day, about 193,000 over the last 7 days. 1.34 million, almost 1.4 million vaccines have been administered just in the last week here in our state. We are stepping up our efforts, not only to provide and to administer vaccine doses, but to make sure we're doing it, yes, in an equitable manner. I am here highlighting leadership, highlighting the success of this community that didn't wait, didn't talk about the way the world should be, weren't dreaming about things, but they were doing. They got an idea, organized an equity collaborative, partnerships that the supervisor was just referencing, and they got working. And they came to facilities like this, pop-up sites, all throughout this region, and administered where people are, recognizing that equity is not just about race and ethnicity. Equity is also about the ability to get in a car, to be closer, proximate to public transportation, to have the ability to even access a device or even understand what to do when you do access a device. You've got to meet people where they are, and it's exactly what folks are doing here on the ground. Again, the first of type in the state of California. And so I'm just here again with that respect, that recognition, and that understanding that we need to replicate this program all up and down the state of California. And here I will close my remarks just briefly updating you on where we are now going forward. While we've administered a little over 6.3 million doses of the vaccine, we have more work to do. Here's the constraint: supply. The constraint is manufactured supply. The state of California is not in possession of 1 dose of vaccine. We do not have a cache or a storage facility of any vaccine. We have distributed every single dose of vaccine that the federal government has provided through a provider network that actively includes over 1,100 plus providers in 58 counties. What we need is more manufactured supply. The good news, just yesterday the Biden administration announced we're going from 11 million vaccines a week to 13 million vaccines a week. For California, let's put this in numerical terms. Last week we received 1,080,000 doses of vaccines. This week, we anticipate receiving 1.28 million doses of vaccine. Next week, end of the month, about 1.32 million doses of vaccines. 1.3 million. That's good. That's important progress. That's visibility moving forward, all things we didn't have in the past that we now have with the new administration. But clearly, on the basis of what we are administering on a daily basis, it's not enough. We'll run through that supply in less than a week. And that's the constraint in this state. I've been up and down this state in large cities, small communities, Madera, down here, other communities on the coast, large-scale sites at Dodger Stadium, at Petco Park, up in Santa Clara at Levi's Stadium. End of the day, we're throttling back many of those sites because of those constraints on supply. I deeply understand that anxiety and deeply recognize the need to provide more certainty in terms of the supply going forward. And that's exactly what we're working on with the Biden administration. I appreciate the Congressman's leadership and his support of the first in the nation Fema sites here in the state of California. They include not only large-scale mass vaccination sites, up to 6,000 doses administered every single day, but they also have mobile sites that go into the community that are also part of that program. California was the first state in this country to partner with the Biden administration, and we launched those two programs up in Alameda County and in East LA just yesterday. That's a preview of what we hope is more partnerships like that to come, more community clinic partnerships, more pharmacy partnerships, more support for mobile clinics, more support for pop-up sites just like this. This is what we anticipate over the course of the next few months. We talk about light at the end of the tunnel. There's light at the end of the tunnel. You heard it last night from the president himself in the town hall. When we get through May into June and July, we will be administering, or at least have the capacity to administer, because of our manufacturing, up to 600 million doses nationwide. That's enough to vaccinate everybody who seeks a vaccination. That's extraordinarily encouraging. But June, July is not March and April. And so over the course of the next number of weeks, we're going to have to be honest with folks about what we can and what we can't do. We have to be mindful that equity is not a platitude, it's not just a platform. We have to truly deliver on that, and we need to be held to account. We put dashboards up, and we said this as a preview. Based on the first allocations, population eligibility, we knew this. This is not unique to California, all across the country, that when those numbers come up, they will not look favorable in terms of the equity index because of the over-representation in a healthcare workforce of people that truly are not as representative of the diversity of a state like ours. And so in the next round, as we are moving forward into the tiers, that prioritization and that intentionality, which I love hearing that word, intentionality, has to be focused on delivering real results to our diverse communities. And so that's our commitment, that's our resolve. And in closing, it's also the platform we have established. And what I mean by platform, literally the platform, My Turn, a new statewide platform that allows for notification and allows for scheduling. We piloted it in LA, in San Diego. This week we're rolling it out statewide. This will provide more up-to-date transparency and data collection, data analytics, and ability to make sure that we're being held to account on these equity metrics. And so that is something I hope each and every one of you take advantage of. Go to My Turn, learn about how you can build a platform, at least gauge that platform, and fill out an application, at least learn about notification eligibility. And for those of you that can't go online, 833-422. 833-422-4255. 833-422-4255. Encourage you to make that call and learn about what program may exist in your community proximate to you is available so that you can appropriately get your vaccination. So that's the update from me. Again, deep gratitude, the mayor, congressman, supervisor, my friend, remarkable Assembly Member Garcia has just been doing a magnificent job. And again, to this entire community, thank you for your leadership, thank you for your stewardship, and thank you for being there for each and every one of us without hesitation in the midst of this remarkable pandemic. Truly, the heroes we talk about in this pandemic, not just our nurses and doctors, not just our frontline employees that are out there in the EMTs or the paramedics or our law enforcement, but it is, as was stated a moment ago, our grocery store workers, our restaurant workers, and our farm workers, those farmers and ranchers as well. With that, happy to take any questions.
Hi, Governor. Thank you for being here today. I'm Rebecca Plevin, the immigration reporter for the Desert Sun. I'll be asking questions for the California Press Corps. You've hinted at more money for the housing to harvest program. Could you provide more details about that?
$24 million. We'll be announcing it formally today. I want to thank the Assembly member for not just his support, his strong advocacy for that program, encouraging a program that's now operational, specifically in about 15 counties. It's candidly been underutilized, and we recognize that. And the purpose of this new appropriation is to maximize its effectiveness. Its effectiveness will be ultimately determined by partnerships like TODEC and others that are on the front lines promoting that program. And that's exactly what we intend to do with this $24 million appropriation.
Thank you. This question comes from Maria Sestito with the Desert Sun. We have a large Latino population here in the Coachella Valley. And though we've had this big push to vaccinate farm workers, we also have many domestic workers cleaning hotels, Airbnbs, the homes of doctors and other healthcare workers. Where do domestic workers fall in the vaccination tiers? It isn't clear from CDPH's list. And what about workers who would qualify but are working without documentation? Are they disqualified?
No, we are taking care, this is a perfect example, this site, that we're taking care of people regardless of their immigration status. I want to make that crystal clear. And by the way, I want to make something else crystal clear, not only the safety and the efficacy of these vaccines, but there's no cost to the vaccines as well. People should just be aware of that as a level setting point. Number two, as it relates to the tiers, we do have multiple tiers in this state, 1A and 1B. 65 and over, healthcare workers in that top tier. We are now in counties large and small all across the state into the second tier, and it's based upon occupational hazard that we looked at categories like farm workers, like food service workers, like folks in childcare, and teachers as well being prioritized, as it is our priority to get our youngest cohorts back into in-person learning, particularly K through 6. It is a resolve and commitment, not just our administration, but I know of people all up and down the state of California that want to safely do that. And in order to do that, we need to prioritize for our teachers as well. As more, to your question, vaccines are made available, we expand the reach of opportunities in terms of the tiers to all of these other categories. And I can assure you, we're looking forward on the basis of supply to doing that sooner than later. But the real constraint remains manufactured supply. And so we are in those first two tiers, at least for the moment, until we get more clarity in terms of allocations later into the spring and summer months.
Thank you. Does the state have plans to vaccinate people who are currently detained in ICE detention facilities?
Well, federal detention facilities are operated uniquely and distinctively from the state. I can only talk to you about our responsibilities specifically and our stewardship at CDCR and what the state of California has done. We have little over 1,000 people that have tested positive in our state system. Interestingly, none in San Quentin. I say that because, as I've noted before to many of you, every morning I wake up, one of the first things I look at on my dashboard is the number of positive patients across the spectrum, and notably in institutions like San Quentin, where we have a population that's very vulnerable. That said, we have prioritized in our state hospital system, as well as CDCR, the vaccination of key staff and people that are in the equivalent of skilled nursing facilities that are detained as priority vulnerable populations. And we have been administering the vaccine. As it relates to federal oversight, as it relates to accountability, we're in a completely different place. My gosh, as much as day is night with the Biden administration compared to where we were just 28, 29 days ago with the previous administration. That allows us more confidence that more appropriate oversight is being offered and afforded people in those federal facilities.
Thank you. This question comes from Joyce Cutler with Bloomberg Law. Would you support and sign any legislation requiring additional pandemic pay, such as cities throughout California have enacted, including Coachella?
I see the world bottom up, not top down. as a former mayor, Mr. Mayor, thank you, by the way, for the hat, which I'm taking with me. Not just this, if I may, though, I may have to pay for it. As it relates to localism, I've said this often, it's determinative. As a former county supervisor, as a former mayor, I appreciate and respect the role and responsibility that cities and counties have to address local conditions and make local determinations for themselves. And so on that basis, I would subscribe to that point of view, bottom up, not top down.
Thank you. This question comes from Angela Hart with Kaiser Health News. She says, what is the rationale for selecting Blue Shield to take over California's vaccination administration without a bid, while not giving other entities a chance to compete for the project?
We want to move expeditiously. We want to move thoughtfully as well. They're doing this at no cost to the state. Blue Shield is a network of 63,000 plus physicians in their PPO, over 370 hospitals. They operate in every zip code in the state of California. They are a logistics operation. Their ability to connect this system, the scale we need in order to get where we want to go, and let me be specific where we want to go. Instead of providing upwards of 1.5 million doses of vaccine a week, which we are currently doing, we're designing a system that can provide and administer over 4 million vaccines a week, 1 to 4 million. It's incumbent that we have the clarity and the transparency of that system, the data, the analytics, the ability in a transparent and real-time way to look at provider incentives and to look at that network at scale and scope. Blue Shield was uniquely qualified to do that.
Thank you. This question comes from Jackie Botts of Cal Matters. You said in your presser yesterday that you'd be announcing the budget deal on your Golden State stimulus proposal today. Can you please help us understand how much money will be going to whom and how soon? And will there be larger payments for undocumented workers who file taxes?
So what I said yesterday, that's one component of what I said. I said we were looking forward to a joint statement, which will be forthcoming with the legislature on an agreement that included, among other things, a Golden State stimulus, that included, among other things, the $24 million that we just announced on the Housing to Harvest program, that includes, among other things, billions of dollars of small business grants targeting our most vulnerable small businesses up and down the state. Grants, not loans. Building on the successful program we launched in November, December, where we've already provided 21,000 grants, 10+ thousand more this week, another 10,000 next week, and with the billions of additional dollars, we will have the capacity to provide for tens of thousands of additional small businesses, nonprofit, and cultural centers grants from $5,000 to $25,000. The details of all of those proposals and all of those agreements will be forthcoming this afternoon.
Thank you. This question comes from Taryn Luna with the LA Times. You've said repeatedly that California does not have enough vaccine to inoculate school staff before they return to the classroom. We know that roughly 200,000 school staff serve grades TK through second in California, which would return first. Yesterday, you detailed federal vaccine allocations of over 1 million doses a week to the state through the end of the month. Why are you refusing to vaccinate even 100,000 school staff per week now if it helps reopen schools for children?
No one's refusing anything. Is to in terms of our focus. Advance very, very shortly, including not just the prioritization, and we've afforded with flexibility based upon supply up and down the state for a number of weeks now, but also $6.6 billion that would address the issue of learning loss in an equitable frame and manner and address the legitimate safety concerns not just our teachers have about returning back into in-person instruction, but also our cafeteria workers, also our janitors, also folks that are driving our kids to school and back home, our bus drivers. And so we're trying to address all of that as part of the negotiation with the legislature.
Thank you. And then this is a non-pandemic question from Janet Wilson with Desert Sun. Do you support the fracking and steaming ban bill that was introduced this morning by 2 state senators? It would also mandate a 2,500-foot setback between oil operations and homes, schools, and prisons.
God bless, forgive me. I'm really honored to be here. I was incredibly pleased to have the chance to meet with some farm workers, one who's about to get his second vaccination, another that's about to get his first vaccination, remarkable nurse that came all the way from Miami to help support those efforts. That's been my focus this morning. Humbly, I submit I have not read what was introduced apparently a few hours ago, any legislation, so I'm unable to comment on it until I have that privilege.
Thank you so much.
Appreciate it, and thank you again for the privilege of all of your time, and just again, let me just express my absolute gratitude and appreciation for these remarkable elected officials who, again, are not just dreamers, they're doers. They get it, and they're getting things done. We're really honored and proud to be here in the Valley, and thank each and every one of them for their incredible leadership. Take care, everybody. Which one?